Hi, I'm Dr. Julie Eshleman, and I am a researcher, a former special education teacher, and a former kid who kind of slipped through the cracks of the education system. And I want to explain today why moving the Individuals with Disabilities Education Act, or IDEA, from the Department of Education over to the Department of Health and Human Services would be a really big mistake. The first thing is that IDEA is not a medical program. It is an education civil rights law, and it guarantees that students with disabilities have the right to a free and appropriate public education, individualized supports, and meaningful inclusion in classrooms. So it is about learning and growth and opportunity, not about treatment or diagnosis of a disability. If IDEA is moved under the Department of Health and Human Services, it would medicalize disability, which turns students into patients instead of learners. And it takes oversight away from educators and specialists who understand teaching and hands it over to health administrators who understand healthcare systems, but not classroom supports or individualized instruction. So that shift doesn't just change how it is managed, it changes our mindsets. When you move an education law into a health framework, education becomes a form of care delivery rather than a civil right. And that means that we have probably more segregation, probably will have lowered expectations, and less accountability for public schools to truly teach every single child. So IDEA belongs in the Department of Education, where people know how to teach and how to include and how to make learning work for every single student. And I think that it's easy to feel like my perspective is about politics, but it absolutely is not. It is about protecting the right of every child with or without a disability to learn and to belong at school. So I hope that you'll share this with people who are interested in understanding this potential change a little better, and that you'll watch out for my next video, where I'm going to talk a little bit about why this issue is important for absolutely everyone, not just parents of disabled kiddos or people who have kids in public schools. So until then, I hope that you will please be kind and make space for one another and take care of your community if you can. See you soon.